So while COVID-19 brought not only the whole world, but also the health supply chain to its knees, as national medical stores, we saw an opportunity and we took it. Ladies and gentlemen, I would like to introduce to you my guest today. For the 6th episode of the NMS Health Talks podcast, we have here with us Michael Lukunyanga, the Principal Surge at National Medical Stores.
Thank you very much. Lukunyanga Michael is my name, Principal Surge Operations Officer, National Medical Stores. I oversee the Surge Operations section, which is a function of the warehouse and distribution operations at NMS. Our main responsibility is to coordinate, plan, and oversee the activities related to the timely deployment and delivery of public health emergency supplies to designated sites. We also support accelerated distribution of non-routine supplies, such as the mosquito nets. These are supplies that are not ordinarily distributed within the routine, but may necessitate to be distributed as part of the interventions that the ministry may be putting in place. And in that case, for malaria, we also integrate some of the supplies into the routine distribution. So whereas they may be initially non-routine, one-off campaign distribution supplies, but may necessitate being integrated into the routine supply chain. So we ease them into our supply process within the operations. Recently, we also acquired a state-of-the-art warehouse in Kajansi. So we operate 2 sites, and our Entebbe site currently functions as both routine but also the primary public health emergency operations site. So I oversee the routine operations at the warehouse in Entebbe. In a nutshell, we are Surge Operations. We aim to provide scalable operational capacity for the corporation to be able to cushion the essential medicine supply chain from any disruptions related to public health emergency needs.
Okay, so for clarity, you don't only deal with emergencies, you also support routine distributions.
Yes, routine distributions usually are supplies that are planned for the facilities for the normal essential medicines, but we significantly support the essential, the surge operations, which are non-routine. Yes, outside of, far and above the surge operations, we also do the routine, because many people would wonder, so what happens when there are no public health emergencies? We continue to support the routine distribution.
That was very good.
Yes.
So how would you differentiate between a routine distribution and an emergency in terms of logistical challenges and that kind of thing?
Well, in principle, routine and non-routine or public health emergencies, they follow the same logistical principles, only that in practice, they tend to vary from one to the other. For instance, the principle of lead time. The lead time in emergencies is much shorter, specifically public health emergencies. It is 24 hours. It is very strict in terms of the response time, while it may be a little longer for the routine. And in that also it may be more scheduled, while for the emergencies, they are more of ad hoc and impromptu. So you have to adapt very quickly. Generally also on the principle of ordering, for the routine, these are planned orders from the procurement plan, while for the emergencies, these are from assessments on the needs based on the nature of the public health emergency being faced. Also, the type of clientele is a bit different, whereas the routine orders, essential medicines, we deal with public health facilities, and in part some private, for not for profit, but that is on program items. But for public health emergencies, the scope of clientele is much bigger, and in this case, that's what I defined as user or designated user sites. It can be a community, it can be a school, it can be anywhere that is designated to receive support in the nature of medical supplies to facilitate the response to the emergency.
Okay, so you mentioned that surge operations came up after COVID-19 happened.
Yes.
So are you saying that if COVID came back again, we would be very ready for it?
Yes. What? Like, we learned quite a lot from the COVID-19 pandemic, and we were fortunate to have taken those lessons very well to allow for the establishment of operational capacity. And like I indicated, that capacity being scalable, it should be able to increase, decrease in the different ways. So as NMS, we have quite an amount of capacity in terms of our ambient storage space. We have up to 38,000. That is very massive, even here in East Africa. Even the cold storage space, we have up to in excess of 800,000 cubic liters of cold storage space. We learned very well that to intercept the transmission of most of these emergencies, you need supplies like vaccines. These are usually under cold storage, and you need to have adequate capacity at the national level. We also have quite an amount of fleet. NMS operates 2 shifts in terms of the personnel, so we are able to process these orders in time. We have in our procurement mechanisms, we've been able to embed with our suppliers framework contracts that allow us to source and obtain supplies with simply a call-off. So these suppliers, the processes of contracting are already in place, since some of these items are actually consumed on an ongoing basis. So the ability to scale up the demand based on the nature of the emergency is embedded within the contract management process, which makes it easy to obtain those supplies. So we also have service providers who we have contracted to support in scaling up instances where we need additional capacity, like transportation, manual labor, and others. One other thing that we do in terms of preparing NMS to be ready, and of course, when NMS is ready, the country is ready, we also undertake to preposition some of these supplies. Prepositioning is the activity in logistics where you move the items closer to the users, and in the country's medical countermeasures plan, the regional referral hospitals are that level of the subnational position where we hold these stocks. So we, on a routine basis, provide them with certain supplies that they can use in their daily operations to avoid them from expiring, but also that facilities can obtain very closely from where they are. And also in terms of the location of our infrastructure, especially the warehouse in Entebbe, it has a very strategic location in terms of where it is positioned, in terms of the facilities around it. It is next to the international airport. That is very good for supplies being shipped in. And also, if we needed to airlift supplies to any part of the country, that gives us very good mileage. We also have the Marine and Air Force bases in and around Entebbe. So we could literally have multiple modes of transporting these supplies, even to the hardest area to reach as may be defined. Beyond that, we also have the road network, access to the express, which gives you access to all regions in this country. So all these put together, you can see that in terms of preparedness and in terms of resources and positioning for NMS, we've learned very well, and we are putting in place sufficient capacity that can be scaled up on the go.
Okay. Wow, that is some good stuff. So I understand that NMS is mandated to distribute essential medicines primarily to government health facilities.
Yes.
How do you work with government health facilities to prioritize needs in the event of a health crisis or an emergency?
Okay, thank you. For emergencies, the way the government has set up its structure, we have through the Ministry of Health, what we call the National Public Health Emergency Task Force, within which there are pillars. These pillars are different functions related to logistics, surveillance, case management, laboratory. So working, NMS being the logistics arm for the Ministry of Health, where the health facilities are resident, we work with the case management and laboratory and other pillars under NMS working under the logistics pillar to identify the needs. In this case, assessments are done to identify their needs, quantify what they need, and then it is approved and then sent to NMS for execution. That is the deployment and distribution of those public health response supplies. Also within the public health response mechanism, we have what we call the electronic emergency logistics management information system, which is able to track and also place requests for these needs in terms of the emergency as they arise. So through that, our staff at NMS have access to that portal and also have training in the use of that portal. So they are able to see these requests being approved, and then we transform them into orders, which are then delivered to the facilities. All that is meant to facilitate a speedy execution of requests in terms of availing supplies to the user sites. As NMS, we're also having to develop the CSSP, the Customer Service Portal. We are developing a window in that portal for the customers to be linked to the ELMIS, through which now directly the facilities can make their requests without even having to send that through the ministry. But of course, the approvers shall be at the ministry. That is leveraging on the existing resource in terms of our NMS ERP.
So for the benefit of the viewers, what is ELMIS in full?
ELMIS is the Electronic Emergency Logistics Management Information System.
Okay.
This one is able to track stock, issuances, requests, as well as approvals, especially for emergency supplies.
So that is being managed by Ministry of Health.
Yes, surely that is.
Shout out to Ministry of Health. They are our mother ministry, and they are the ones that oversee emergencies handling and emergency handling. So Michael, could you give us an example of an emergency that NMS has handled successfully, and what were the key takeaways?
Okay, like you said in the beginning, right from the time of COVID, we've had to handle all those emergencies in terms of what is needed to be deployed to the facilities. We were learning so many things from the time of COVID. In the recent past, we've had to deal with red eyes, we've had to deal with anthrax. We are now dealing with mpox, monkeypox. But the interesting one was the Ebola outbreak in Movende and Kasanda. We had previously Ebola outbreaks in Bundibuji and other areas along the Congo border, but the outbreak in Movende and Kasanda was very concerning because of the way it was evolving. The thing that we took away from that was, one, the power of collaboration. It definitely came to light that the private sector had to be involved in terms of the private public, the private facilities, the schools, and all other entities. So collaborating with agencies like WFP and UNHCR to reach out to the private sector while NMS managed the delivery of supplies to the public facilities was very key, and especially maintaining supply to the isolation centers that had been created there. So it also gave us an opportunity, as a second takeaway, it gave us an opportunity to test the mechanisms that we had put in place as a country for the first time, because when COVID came, we had mechanisms that had been put in place but had never been tested. So this time they were being tested. All our resources, the logistics and the planning mechanism, the governance systems, and the medical countermeasures plans were tested to a good extent. You know very well that public health emergencies are not easy to simulate, because these are real situations that affect the communities and the public. So it is not something very easy to simulate, and you get to understand the level of your preparedness. But we took it quickly to make sure that all the mechanisms that are in place could be actually deployed and tested in a way. And it came out very well that that emergency was managed and contained. If you remember, it was around the Christmas time where people were moving up and down and all over the place. The other thing that we took away from that particular emergency was how we handled the prepositioning. Prepositioning in public health emergencies is where we pre-deliver items. So we had earlier positioned supplies, and it was easy to start the response with what was already positioned in those facilities, regions, and in those areas. So we were only replenishing additional supplies in that. So it became very important, and it is a standing requirement for us to have continuous prepositioning of these supplies rather than have them hold them at the center here. And lastly, I think it was about the post-distribution emergency operations. Usually after everything has gone down, many things remain unattended. You have equipment, you have investments that have been made, but they tend to go unattended. So there has been a proper post-distribution management plan that was also deployed, where certain equipment can be stored and then retrieved for future use. So those were our key takeaways in terms of that particular emergency. So what we are doing now with the MPOX is more of like routine operations on the side of emergency handling.
Okay.
Yes.
So what you're saying is when you're so ready to handle an emergency, it actually becomes routine in
Yeah,
a way.
it becomes routine in a way, like in practice, the practice becomes normal. You're able to deploy, redeploy, retrieve, accelerate, scale up the resources so that they are always in some form of motion, like it always is with logistics.
So that flexibility that you're talking about, for the benefit of the audience, that equipment that the post emergency equipment that you talked about, what is that? What does that mean?
We have certain infrastructures that are used during emergencies. For instance, the isolation tents, beds, and other non-consumable items that may be reused in other areas, but are not routinely used in the daily operations of the health facilities. So these also, we are, as a country, accumulating some of them, building in form of supplies for the response. So these have to be retrieved and kept properly and even repositioned for future emergencies. So there are several equipments that may not be used in the daily operations that may require to be used in subsequent emergency operations.
Okay. So I understand that time is always of the essence when you're handling an emergency. So what unique challenges do you usually come across in terms of timely response to an emergency?
Yes, time is of the greatest essence when it comes to emergency. And in terms of that time, it is the response time, not the reaction time. So, what is unique about the emergency logistics is the sacrifice that has to be made, first of all, because this operation does not should not be disadvantaging the routine. It is supposed to be cushioning the routine while executing at 3 times or even 10 times what would be the routine. So it is moving much faster. So it is the interesting bit with emergency logistics, and the unique nature is that it has to be a parallel operation in terms of execution, while it is leaving the same discipline in terms of logistics. Like I said, the lead times are much higher and much faster. But in terms of challenges, it faces similar challenges like any other logistics operation. You will look at things like the timely nature of those requests. That's why it is very important that we have an electronic system, and we're also very excited that our in-house ERP should be able to give us access to those orders even much faster. So the quality of those orders also, or those requests, is very key, because when most of these facilities are populating uh, requests, they tend to include even non-medical supplies based on what is going on at the facility. So for us to filter through these requests, all that is time, and yet we want to make sure that we make best use of time by receiving the highest quality of the request. I know there is separation of this information at the ministry, but if it can be done online in one go, then that should be able to make better use of our time in the response. Other logistical issues range from the porous nature of our borders sometimes, the distance from the user unit where it has been set up. But the porous nature of our borders makes it very uncomfortable in terms of how easily we can be exposed to some of these emergencies. Yeah, in terms of time, those are specifically the issues there around there. The innovations that NMS makes may also come from what we have been experiencing, and the first one, of course, is the addition of emergency ordering onto the CSSP. That will definitely help us to have these orders on time. Other innovations, of course, are NMS innovations, like leveraging on the existing logistics infrastructure, like the regional offices. So we've managed to engage and allow for the response mechanism to engage with our regional offices in terms of getting any information across. We have 10 regional offices across the country, and these are always in touch with the public facilities, and have also been asked to monitor, and they do attend those district operational committees that respond to emergencies. So in that case, they also monitor whatever requests are coming through on our side, or how those requests are being delivered to facilitate the response to the emergency. So all these mechanisms support the delivery. However, in terms of the section, something we did a bit small, it is something that exists, in the operations, but it was not in use. During the COVID-19, we experienced a significant demand for oxygen. And the biggest source of oxygen was the regional referral hospital plants, which were very quickly overrun by the demand at that time. So we had to deliver oxygen in cylinders from NMS. At that time, the oxygen cylinders were the property of the facilities, and it necessitated obtaining them and then refilling and sending back. That would go up to about 48 hours before you would actually get oxygen to a specific facility. So internally, we convinced management, and we are happy that they accepted and they supported us, including the management of Ministry of Health, to deploy a mechanism that has now turned out to be a routine, and we named it the exchange on delivery. So this is a mechanism that already exists in other beverage companies, where you come with a filled container filled with the content, and then you give me an empty. So all we would do for the oxygen now was simply carry get the request in terms of how many empties they have. We lift that onto our trucks or airlift it, and then deliver it to the facility and get empties in return. So that gave us a round trip of delivery rather than moving around, collecting empties, then filling them, and then delivering them. So that cut the time of delivery for oxygen by half. And this has become the model for distribution of oxygen.
Okay, so what you're saying is that these empty oxygen cylinders are refilled at NMS, National Medical Stores.
Yes, they do.
And so what is the capacity? How many can you refill in a day?
Oxygen cylinders, currently we are yet to establish our plant. So we source suppliers who have given us the ability to fill up to about 300 per day. So that determines how quickly we respond to the facilities. We currently have 2 contractors supplying us with oxygen, but we are in the advanced stages of establishing our own oxygen production plant at NMS. That plant has the capacity of about 200 cylinders per day, but we also have a liquid oxygen tank being installed that was donated by the Global Fund through Ministry of Health. It has up to about 6,000, the equivalent of 6,000 cylinders in one refill of that tank. 6,000 cylinders can supply our routine delivery of oxygen for about 3 months, delivering to the different facilities, and within which time we will have also received supply of the same to refill from the suppliers externally. So that in terms of oxygen supply is a good buffer for us as a country.
Okay. So that brings me to my next question. What resources or partnerships do you tap into when you're doing emergency handling?
I think the resources we have, first of all, are the humans, because these possess the skills, and they possess the requisite skills for executing emergency operations. We tap into the logistics processes and leverage on the NMS existing and other health supply chain processes. We also tap into the technology that is available to try and, because the technology is an enabler for us in executing the emergency response. In terms of partnerships, we have several. I think our immediate partner is the public, the general public itself. They are the people we are serving, and they are the people that are being affected by the emergency. They are also the people that pay the taxes for which services we provide in terms of providing them with commodities. Several partners, of course, our mother ministry, Ministry of Health. In there is the Public Health Division that is directly responsible for managing public health emergencies. We also have the National Task Force and its related pillars, and of course, the health facilities. We partner with them in making sure that we have these supplies available and accessible and adequate for the public to and the population to access. Ministries, departments, and other agencies, NBA, Customs, UNBS, Ministry of Finance, Ministry of Defense, all these agencies working together, even Ministry of Agriculture, working together in the One Health platform. Also, we are able to collaborate and partner with them in executing response mechanisms and of course the Office of the Prime Minister. Partnerships also range from what we have as suppliers, because our relationship with them is beyond being contractual. It is also a partnership in a way with our suppliers and service providers, but also the donors, implementing partners, and development agencies such as WHO. These provide the standards and also the guidance on how to manage these public health emergencies. And also in terms of contractual arrangements for international obligations, we saw a very useful partnership, like has always been with UNICEF in executing international procurements for some of these specialized items, especially in the response that come with things like diagnostics and vaccines and others. So other partnerships for UNHCR, WFP, all those logistics ones, and also implementing partners in the country, different CSOs that are actually in the communities and are reaching out to the people. So we partner with them either directly or indirectly through the ministry.
Okay, so you have mentioned the power of collaboration and partnerships. Okay, how does your work contribute to the overall disaster preparedness of the health sector in the region? Not just in Uganda, in the region.
In the region, the preparedness of NMS is critical. Uganda is a landlocked country. We've seen several factors that can actually cause us to be directly or indirectly affected by the public health emergencies. And we've also learned that our level of preparedness can actually be an advantage to the East African community. So there are also discussions and engagements on establishing an actual regional hub for our center of excellence in terms of emergency preparedness for the region. We've seen our neighbors being affected by very many of these emergencies, South Sudan, Rwanda recently, even Kenya, Burundi, and all these members of the East African community are from time to time affected by that. So having porous borders and also being the country that we are, we also accommodate refugees, a significant number. I think we are the most hospitable country in terms of refugee hosting. And this comes with a lot of demands in terms of preparing for what comes with these kinds of requests. We saw recently in Rwanda when they had Ebola, I think, yes, we as a country, Ministry of Health sent professionals to support the response mechanism in Rwanda. That comes because the country has sufficient human resource that are trained and have actually participated in real response mechanisms, like the Ebola crisis in Kasanda and Mubende. We also, personally, I was nominated to support South Sudan in setting up their national cold chain, for the ultra cold chain, the one where we are able to store the Ebola vaccines at the time, so as they could be able to respond to that crisis. So, as a country, we have a medical countermeasures plan, and we're very fortunate to have had it before COVID. So what happened during COVID was simply to pull this plan out and actually actualize it. So what we have now is a plan that has actually been put to use and proven that it actually works. So our preparedness level as a country in this region is very, very important for the health security in this country and the region at large.
Okay, impressive. This conversation has given me renewed confidence in our health sector
Yes.
and national medical stores. So, Michael, what's your parting shot to the viewers?
Yes, thank you very much. Like we experienced during the COVID-19, our biggest lesson is that we learned everything and we have forgotten nothing from that experience of COVID-19. So we can only move forward in that regard in terms of responding to public health emergencies. The range and scope can only grow, but we shall make sure that we continue to be committed in executing our role and mandate as NMS, being the logistics arm for the ministry and for the country in responding to public health emergencies. Of course, we commend the foresight of the management of Ministry of Health, the board and management of NMS in allowing for the establishment of a scalable operational public health emergency response mechanism in the country. This ensures that there is a cushioning for the continuity of service delivery in the core essential medicine supply chain. And this is very important for the country and for the ministry in terms of managing disruptions that come with the public health emergencies. So as people, as individuals, we are all urged to do what in public health emergency we say prevention is better than and cheaper than cure. So as an individual, always look to work in a mode that you're emphasizing your prevention rather than cure. So our preparedness as a country is more to ensure that there is better prevention of the occurrence and the disruptions that arise from public health emergencies.
Thank you so much, Michael, for agreeing to be hosted on the podcast. I want to thank the viewers and also the team for making this podcast possible. Remember, like Michael has mentioned, prevention is better and cheaper than cure. Don't forget to hit the like button and subscribe so that you don't miss out on such amazing podcasts that will be coming in future. Happy New Year 2025 and see you in the next episode. Ciao.